prescription. I believe my doctor called it in.
Okay, let me check it for you. What's your last name?
Schreier, S-C-H-R-E-I-E-R.
And first name?
Darcy,
And what's your date of birth?
October 4th, 1968.
Could you just verify your address for me, please?
40 Foster Street in Worcester.
Okay, great. So I do see an insulin prescription from Dr. Serafin. Is that correct?
Yes.
What did your doctor tell you about the technique and how to use it?
She just told me to inject it once a day.
Okay. Would you have time right now for me to demonstrate the technique and go over the direction?
Yeah, I can do that.
Okay, so let's go over to the consultation area.
Okay.
Hi, so I don't think I introduced myself. So my name is Amy. I'm the pharmacist at MCPHSU Pharmacy.
Okay.
So your doctor prescribed you Lantus insulin. So before you use it, you want to keep it in the fridge. But the first time when you use it, you want to warm it up in your hands. So what you want to do is hold it in your hands like this for about a minute or so that it'll be room temperature, because you don't want to inject it cold. And then once you have that, you want to inspect the vial to make sure there's no cloudiness. But if there is, what you want to do is you want to roll gently like this for 10 to 20 times.
Okay.
And then inspect it again to make sure it's not cloudy. So after that, what you want to do is you want to take the cap off. And you want to wipe it off to make sure it's sterile. And then let it air dry. And then get the syringe. And make sure you don't stab yourself, so just be careful. Your doctor's direction was to inject 10 units, which is 0.1 ml on the syringe at that time. So before you draw out the insulin, what you want to do is draw out the air. And then there are markings. So the first black mark and then the bottom mark. So what you want to do is line up the first black mark to 0.1 ml. So So 0.1 ml. Okay. So after that, push the needle down into the syringe, into the vial, and then push the air out all the way. Now you're ready to draw the insulin. Again, you want to draw it to 0.1 ml with the first black mark, and then while you are doing that, make sure that there's no air bubbles, or try to minimize it so that you get the right dose. Okay. So draw it slowly. Okay, so now you have 0.1 ml. Okay, and now you're ready for injection. Okay, so you have the choice of where you want to inject. So you can do upper arms, upper thighs, abdomen, buttock. So I just put this dummy thing on here to demonstrate it. Okay. So before you inject, you want to wipe it off in that area. So get the alcohol swab and then go from the center and then outward. You want to do that. Okay. And then let it air dry. Okay. And you want to pinch the skin like this when you're injecting, and then pinch it the whole time while you're injecting it. And then I'm going to have the needle, and then I'll be coming it, like, inject it from like 90 degrees angle. Okay. So pinch the skin, and then just, inject like that, and then push the insulin slowly all the way down, and then hold it for like 10 seconds, okay, while still pinching your skin. Okay. After that, slowly take the syringe out, and then you're done. But you just want to just cap it to make sure it's safe, and then dispose it into the resin. Okay. So that was easy, right? So Just to make sure that I explained it to you and I didn't miss anything and you understood it, could you just walk me through?
Okay, so I'm gonna get my vial of insulin, and I want to make sure that it's not cold. So warm it up in my hand, and then I have my syringe, and I'm going to put 0.1 milliliter of air into it, and then I'm gonna inject the air into the vial, take out 0.1 mLs of the insulin, and I'm gonna wipe the area with alcohol swab, and then I'm gonna pinch it and inject it, hold it for 10 seconds. And then throw it away in the shark.
Okay, that's good. So before you leave, I just want to point out a few things. So the expiration date is listed on the bottle, and that's how long it's good for, as long as you don't open it and keep it in the fridge. And then once you open it up, it's only good for 28 days at room temperatures. You don't put it back, just keep it at room temperature. And then just to remind yourself, like maybe write a note on the bottle when you first open it so that you know it's only good for 28 days. And then another thing is you want to rotate your sides because you don't want to have it swollen or so just rotate the side right, left, and then the next day so just try to rotate it.
Okay.
Thank you.
Hi Amy, is my refill ready yet?
Hi Darcy, yeah. So how are you feeling today?
I've been okay. I've been taking the insulin like you told me and following the technique and everything. And my symptoms got better at first, but now I'm starting to get the same symptoms again.
Okay, could you tell me a little bit more about the symptoms you've been experiencing?
I'm a lot more tired than normal, and I have to get up in the middle of the night to go to the bathroom, go a lot more during the day as well. And sometimes I experience blurry vision too.
Okay, what about your blood sugar level? Have you been testing with your test strips?
I tested this morning and it was like 150.
Oh wow, that seems a little bit high, and based on the symptoms you just told me, we might need to make an adjustment in your insulin dose. So what I'll do is I'll call your doctor and report the symptoms that you just told me, and then I'll make a recommendation. Is that okay?
Okay. Doctor's office.
Hi, my name is Amy. I'm calling from MCPHSU Pharmacy, calling about patient Darcy Schreier. She's a patient of Dr. Serafin. Is the doctor available?
This is she.
Today she came into the pharmacy to refill her insulin. When I counseled her, I found out that she has been experiencing fatigue, blurry vision, and frequent urination. Her last blood glucose level that was checked this morning was 150. I also assessed her to make sure that she has been using the insulin properly with correct directions and the technique. Based on the assessment, she may need an increase in her insulin dose. I recommend changing her Lantus dose to 20 units once daily from 10 units that she is currently on.
Okay, give me a second to find her chart. Okay, that sounds good. You can change the prescription to 20 units once daily and tell her to call my office to schedule an appointment within a week.
Okay, thank you, doctor.
Thank you. Bye.
Darcy?
Yep.
Okay, so I just talked to your doctor, Dr. Serafin, and I recommended changing the insulin dose to 20 units at that time instead of 10 units that you are currently on, because it seems like your blood sugar level is still high and we need to adequately control that. So I think 20 units will help you and make the symptoms go away. So I got the new prescription, the doctor approved it. I'm going to be filling it. Would you have time to wait for it now, or did you want to come back?
I can wait, I have a magazine.
Okay, so I'll fill it, and then also your doctor told me that you should contact the doctor to make an appointment to make sure, the doctor wanted to follow up with you, and then I will also follow up with you when you come back for a refill.
Okay,
So
sounds good.
Give us about 15 minutes, we'll clinic when it's ready.
Great.